Thank you for inviting me today. It's a pleasure to be here. I'm Gordon Heinrichs. I'm a medical writer, and currently I'm working on my latest book, Health Literacy: Your Key to Good Health. And what's really interesting about health literacy is that even though it's a worldwide health issue and one of the most correctable health issues of this century, almost no one's heard about it. Now, you could argue that yes, it may be worldwide and yeah, it may be correctable, but it's such a small problem that nobody's paying any attention. Well, you know, that's a very strong argument if you disregard the facts. The facts are that low health literacy adds about $100 to $200 billion per year to the U.S. healthcare costs. It's about the same as diabetes. Who hasn't heard of diabetes? Who has heard of low health literacy? And if you extrapolate that $100 to $200 billion per year in the United States alone that's wasted, worldwide, what are you talking about, $1 trillion? The American Medical Association says that poor communication is one of the prime causes of medical errors. So how would you go about improving healthcare communication? Well, we're here talking about it today. We would use health literacy guidelines and principles. So today I'm going to introduce you to the topic of health literacy. I'm also going to share with you some of those guidelines and principles that I just mentioned, specifically two principles, and two of them that are, I think, so important that I call them the alpha and the omega, because they can erase a lot of health literacy sins. And then finally, I'm going to suggest to you how you can improve health literacy and why health literacy is personal to me and it's also personal to you. And when I'm done, I think you'll agree with me that health literacy is actually your key to good health. So I've got this golfing buddy. His name's David, and we've been golfing together probably 20 or 30 years, and he's been on the West Coast for a little more than that. He's from New York, and he's still got a pretty thick New York accent. And David's about 6'3", he's a former college basketball player, he's got prematurely gray hair, and he has a kick to be around. He's a great storyteller, a tremendous communicator, and even does some motivational talking. And David uses each one of those skills every day he goes to work, because he teaches math in high school. But he teaches math in high school to kids that come into high school at the 3rd and 4th grade skills level. Now, unfortunately, David's had a rough time at home for about the last 10 years because his wife was diagnosed with bipolar problems about 10 years ago. And she's really had a rocky road as far as the treatment and recovery goes. And so it's been a tough time. And then about 7 years ago, his son Chris, when he was 17, was diagnosed with schizophrenia. Well, wouldn't you know it, about the first 6 months after Chris's diagnosis, he was not responding to the treatment. They tried different medications, they tried different doses of medications, they even tried different doctors. Nothing seemed to be working. But one day David is talking to his pharmacist, and the pharmacist says to David, you know, this is a real conundrum here. I wonder why Chris isn't responding to his medication. We haven't figured something out here. Most people tend to respond to these medications. Is Chris taking his medication properly? And David says, yes. And then the pharmacist goes a step further and he says, well, David, can you explain to me how Chris is taking the medication? So David says, yeah, he's taking it exactly as prescribed. He's taking his medication on an empty stomach. He takes it right before he eats breakfast each day. Well, the pharmacist has kind of a smile on his face and a kind of a wide-eyed look to him. And he says, David, I think we've figured out what the problem is with Chris not responding to the medication. Essentially, he's taking that medication on a full stomach because the medication and the food are there at the same time. So here we have a very simple medical concept. How much simpler can it get? Take your medication on an empty stomach, and yet it was done improperly. There was misunderstanding. misunderstanding between two very intelligent people. So what lessons can we learn? We've got 4 lessons we can learn from this story of David and a pharmacist. And the first is that, especially with medications, very small misunderstandings can lead to some pretty drastic consequences. If you want to see what that looks like, look on the web. You'll be able to find those pretty easily. The second lesson that we can learn is that the decisions that parents make frequently can affect the children. The third is the alpha principle. The alpha principle is called teach back. And teach back is something that you probably already do at home, you just didn't know you were doing it. So let me give you an example. So you've got Johnny, he's 5 years old, and he loves to play outside. And so you send him out in the front yard, and then you're looking out the window, and you see that he's playing in the street. Well, that's totally unacceptable. And so you bring him in, you sit him down, you read him the riot act, and you tell him all the reasons he should not be playing in the street. And then you say, Johnny, did you hear what I said? Yes, Mommy. You know, but you're smarter than that. You go the extra step. You say, Johnny, tell me all the reasons that you shouldn't be playing in the street. So what you've done there is the second question you asked was what's called an open-ended question, because it promoted communication, understanding, a conversation. The first question you asked was a closed-end question, because closed-end questions typically require a very short answer, yes or no. That's usually it. Well, let's go to the story of David and the pharmacist. So the first question the pharmacist asked David was a closed-end question, short answer. But the second was an open-ended question, and now there was understanding. There was communication. There was a conversation that solved the problem. And that's the essence of teach back, asking open-ended questions. Now typically, teach back is initiated by the healthcare provider, just like it was with David and the pharmacist. But it doesn't have to be. So let's say you're sitting in your doctor's office and you're sitting there writing things down. Your doctor's giving you all this good information. And then your doctor says to you, Mrs. Jones, did you understand what I said to you, all the instructions I gave you about all your diabetic medications and how to take them properly? Well, you were sitting there and you were writing things down, but it was pretty complicated, and maybe there were a few things that you think you may have missed, but you don't want to be embarrassed and have the doctor think that you're not very bright, and you certainly don't want to embarrass the doctor and maybe imply that he or she may not be a very good communicator. So most likely you're going to say, yes, I understood that. Short answer to a closed-end question. But you don't have to answer it that way. You can turn this around. You can say something to the effect, Doctor, what I understood you to say was, and now, without anybody being embarrassed at all, you've turned a closed-end question into an open-ended question. You've done teach back from the patient's perspective. And now you've got communication going. You've got understanding. You've started a conversation. So that's the essence of teach back. The fourth lesson that we learned from the story of David and the pharmacist, and this is something I didn't share with you yet about David, is he'd gained a little weight as time had passed. A lot of us do that. And he'd developed adult onset diabetes. And he's had it for several years. He's had it for quite a number of years. And he's doing really well now. He's doing yoga. And so he's lost some weight. The sugar is really under control. So do you think if Chris, his son at the age of 17, had also developed diabetes, there would have been any of this misunderstanding going on? Well, I don't think so. Because even though I haven't given you the definition of health literacy yet, but from this example, we can say that David has a high level of health literacy, high level of understanding, high level of decision making with diabetes, but a low level of health literacy with schizophrenia. And I think we can all put ourselves in David's shoes. I think we're all vulnerable to low health literacy, because I'm sure there are many illnesses or conditions, medical-wise, that you are very familiar with, and so you can put them in your high health literacy bucket. But there certainly are others that are in your low health literacy bucket you're not familiar with at all. And there may be a time when you want to or you need to move a condition from your low bucket to your high bucket. And that's exactly what the researchers that research health literacy and study health literacy are trying to figure out. What's the best way to help you and everybody else move something from their low bucket to their high bucket? And so, what is the definition of health literacy? Well, I'm not going to share it with you. The definition's a little long, and you can look it up on the web. You can look up health literacy definition. You'll see actually several different definitions that are all pretty similar. It depends on what researcher you're looking at that particular time. But I'm going to share with you a paraphrase of what you might call the official definitions. But my definition is a little easier to remember, a lot easier to remember, and a little easier to understand maybe. So that definition is: excellent communication leads to informed medical decisions. It's like an equation. This leads to that. And health literacy includes not only reading, writing, and speaking, which I'm going to focus on today, but listening, calculation, memorization, attention, and problem solving. So let's say we're looking at this equation or this definition. This leads to that. Where does that information typically begin? What starts this whole process? Well, it usually begins in your doctor's office, especially with your personal information. But it can come from your hospital, it can come from the federal government, it can come from the public health department, it could come from your TV set. You see those medical ads on TV all the time. So let's say you're in your doctor's office, and by the way, you all look very intelligent here, so I know you will have all chosen good doctors. And not only good doctors, but doctors that have the latest information for you. So let's say you're sitting in your doctor's office, and your doctor is sharing all that latest information with you. So you're taking it in, and you're writing things down. So now, are we guaranteed that we can make an informed medical decision? We just got the good information, the latest information. Well, there's no guarantees. There's no guarantees because maybe the information you just received was too complex for you to understand. So how would your doctor go about making that information understandable to the layperson, to you and me? Well, your doctor would use health literacy guidelines. I'm going to share some of those guidelines with you. The first one is plain language. And you can look this up on the web if you want to get the big picture of plain language, because I'm just going to share with you a very short portion, but the essence of it. The big picture, plainlanguage.gov. But the essence of plain language is using simpler medical terms for more complex medical terms. So your doctor could say, Bill, I want you to take this analgesic. Or your doctor could say, well, I want you to take this pain reliever. Or your doctor could say, Betty, I want you to take this orally. Or the doctor could say, I want you to take this by mouth. Or your doctor could say, that's a benign condition. Or your doctor could say, that's a non-cancerous condition. So that's the essence of plain language, using simpler medical terms for more complex medical terms. What are some of the other guidelines that your doctor could be using? Simple, clear diagrams, numbers that make sense. And by the way, there are volumes of information written on each one of these. Simple, clear instructions, forms, manageable forms, You know, some people think that complex and difficult forms, I've filled out plenty myself that were complex and difficult. Many people think that's the norm. And it may be the norm, but it doesn't have to be the norm. Readability level. What's readability level? Well, readability level is the grade level. It's the grade level that the information is written at that you're reading, the medical information. And most of the medical information is written at the 10th grade level and above. But to reach the broadest audience, it should be written at the 6th grade level. The last one I'm going to share with you is called presentation to motivate. What does that mean? Well, has anybody ever taken that strip of paper out of the box, the prescription box? You got this little medication box here, and you take the strip of paper out, and it's got this real teeny writing on it, and it's real skinny. And has anybody ever actually read that? You know, I have to admit, and this is embarrassing, I've never read that. The sad thing is, I'm sure that's good information on there. It's there for a purpose. It's there for you and me to learn something, maybe to help ourselves. I've never read it. I'm not motivated to read it. Medical information should be an open invitation for you to read it. So in other words, if you pick up a book or a pamphlet or some sort of guide, you should be able to look at that without reading any words at all before you've read anything and say to yourself, hey, I want to read that, and go ahead and read it. Because the other option is to pick it up, like I've done those strips of paper, and set it down and maybe read it some other time. So, that's presentation to motivate, and those are the guidelines. And so let's say your doctor is not only smart, your doctor is not only up to date, but your doctor is using every one of those guidelines to share that information with you in the doctor's visit so that you and I can understand it. So now, finally, are we at the point where I can make an informed medical decision? Is there a guarantee now that I can do that? Well, no. There's still no guarantee because that information, understandable or not, is still got to go through here. You've still got to process that information. So if I was going to suggest to you what would be your best office visit. In fact, I'm going to suggest that right now. I'll show you. I would suggest you read one of these self-help books. These things are great. There's about 6 or 7 of them. They've got questions, they've got lists, diagrams, stuff for you to do, stuff for you not to do. You know, what kind of attitude you should have when going to the doctor's office. These are really great. And after you've read that, and you go and you're expecting, you know, your office visit, and you can be primed, you can be focused, you can be ready for that visit. And if your doctor is on the same level that you are at that time, you're probably going to have a very good office visit. But there are other times when you may not be primed, you may not be focused, you may not be ready. You may have what I call foggy thinking. There are many things that can cause foggy thinking, and I'm going to go over a few of them right now. The first one I have to consider always is medication. Does anybody have this book? Worst Pills, Best Pills. Pretty thick. It's thick because they preview about 580 of the most common medications that we use in the United States. They have lists, and one of those lists is a list of the medications that can cause, guess what, foggy thinking. It's not what they call it. They call it a medical term, and as they should, but it's foggy thinking. About 50 of the medications on that list of 100, so 50 of 100, so out of the 580, so we're talking about 10% of the medications in that book can cause, according to them, foggy thinking in a very subtle manner, such that it's not obvious that you just took that medication and now you can't think straight. So it's difficult to figure out a lot with these medications, and some of those medications on the list of 50 are some of the common medications that you would immediately recognize. The biggest risk, again, according to the book, for mental impairments, foggy thinking, are the so-called minor tranquilizers and sleeping pills. And we take a ton of those in the United States. So what are some other factors? What are some other of the foggy thinking factors? Well, illness, fatigue, depression, fear. Let's say you're a cancer survivor. Thank goodness. But you probably go into the doctor every 6 months for a checkup. You know, a lot of times maybe the rest of the office visit is just a blur. You're just waiting for your doctor to say yes or no. Did it come back or not? Fear can play a big role. Emotions, fatigue, all of these individual factors can cause foggy thinking such that you don't have a good office visit. So you're not ready, you're not focused, you're not ready to have that visit. In a minute, I'll give you an idea what happens when you start piling those onto each other. The bottom line is, whether you have been presented with the information using all the guidelines, the health literacy guidelines, or whether you have the clearest mind possible or you have foggy thinking, you still have to make an informed medical decision. And it's actually your doctor's responsibility to find out, to make sure that you understood what was going on during that office visit, and to verify that you understood. Now, how would your doctor go about doing that? There are many ways, but one way is a way we've already talked about in this presentation. Teach back. Your doctor could ask you an open-ended question that starts a conversation, that starts communication. About a year and a half ago, I went into the hospital with acute kidney failure. And this was after 65 years of virtual perfect health. I had had no surgeries, was taking no medications, I exercised regularly, I ate right, I got enough sleep. I've even worked in the healthcare industry for about 40 years. I even worked in hospitals for 15 years. I'm not intimidated by hospitals. So if there was anybody that was ready for a significant medical event, it was me. I was ready. Hopefully it wouldn't happen, but it did happen. So I was there in the hospital. After one day in the hospital, I was a basket case. It was as if I had aged 30 years. I was as if I was 96 in one day. Fear, depression, emotions, medications, fatigue. I had them all. But I also had my omega, and that is bring a champion. That's what I'm going to call it, bring a champion. My wife was with me during the hospital. Now it's nice to have a companion with you when you go to the doctor's visit or go to the hospital and have a consultation. It is great to have somebody there to support you and to hold your hand. But a champion goes extra steps. A champion is there to help and ask questions, to answer questions, to write things down, to maybe even write questions down before you go to the office visit or the consultation. And then finally, the champion is there for you afterwards to have a conversation with you to make sure that there was understanding during that office visit. And I take my wife to my office visits all the time now. And there have been several times where there's been misunderstanding, different versions of actually what took place, but afterwards there was understanding because there was a conversation that took place. So this is why health literacy is personal to me. And that's why it's personal to you. So what I've done today is shared with you health literacy, introduced you to health literacy and some guidelines and principles. Also shared with you my personal story, why health literacy is personal to me. And I'd like to share the health literacy story further. So if you happen to be a member of another service organization or a social group or a church group or a business group, and you think they would benefit from learning more about health literacy, I would love to hear from you after this presentation. And I'm going to leave you with a story about, it's a Chinese story. It's about a student and a teacher. And so the student asked the teacher, "Teacher, tell me about heaven and hell." And the teacher says, "No problem there. First, let's go to hell." So what we see in hell is we see this huge table filled with scrumptious food, and there are all these people sitting around the table, but the people are very unhappy looking, and they're very scrawny. They look like they haven't eaten in ages, even though the table is filled with food. Well, they're sitting there with these 3-foot chopsticks, and they can't feed themselves. Well, now let's go to heaven. So let's go up here, and we see this huge table again, and piled with wonderful food. People sitting around it. They look well fed. They look happy, but they've still got these 3-foot chopsticks in their hands. Well, they're eating well because they're feeding one another. And this is how it can be. If you learn more, I hope I've encouraged you to research more into health literacy, and you start talking about health literacy in your doctor's office. Maybe you hear words that aren't plain language, or maybe you see a form, or you filled out a form that wasn't easy to understand. You start sharing that information with maybe your doctor, or maybe somebody else, somebody that you can share that information with, and certainly be kind and gentle. People don't really like criticism too much, but be nice and gentle and inform them of what's going on. And so what you've done is just like the story, the heaven and hell story, the student and the teacher. What you've done, if you talk to your doctor or your doctor's office people about health literacy, and you start to change the culture in that office, you not only help yourself, but you help every other patient that goes to that doctor. So thank you for giving me the opportunity today to talk to you about health literacy.